Hello everyone, welcome back to Public Health Insights. And today's topic is one of the foundations of community medicine, public health, as well as epidemiology. The topic is natural history of disease. So, we'll also discuss models of disease causation, but that will be covered in another video. You please watch both the videos for a clear understanding. And also, I'll be connecting the topic with levels of prevention so that it becomes very flowful. The topic will be very easygoing, and by the end of this session, you will have not only a deep understanding but also you'll have a clarity on how questions are asked, and you'll also be prepared for UGC NET and NEET examinations, because this is one of the most fundamental topics that are asked in the examinations, whether it is your theoretical examination or any kind of competitive examination, because this will form a base for your understanding. And if you have this clear in your mind, that will help you write any kind of answers on any kind of diseases. And the flow of writing is also very important on how you need to proceed. Like first of all, you need to understand the definition, then you need to know the history, you need to know the models of disease causation, and then subsequently the phases, stages, and the level of prevention. So that is going to help you overall in the preparation, and I think that the topic will be very easy going. And if you find any kind of suggestions, or if you find any corrections in the PPT or in whatever I am teaching, then please reach out to me through the comment section, or you can also reach out to me directly on LinkedIn, and I'll be happy to help. Thank you. So let's start. First of all, let's know what all I am going to cover in this video. So first of all, I'll be giving a brief introduction. Then I'll be explaining the importance of the topic. Then I'll be moving forward to the phases, that are pre-pathogenesis phase and pathogenesis phase. Then I'll be covering the stages like susceptibility, subclinical, clinical, and outcome. Then I'll also cover iceberg phenomena of diseases, because it's very important for you to understand. In many examinations, especially in theoretical examinations, university examinations, you'll be asked iceberg phenomena of diseases. Explain it. So it's very important for you to understand what does it mean, and then you can write a lot of content about it. It's very easy. Then we'll be moving forward to the levels of prevention. I have also prepared a flowchart of disease progression. Then for the clear understanding, I'll be summing up all the concepts through a case study on tuberculosis that will make the topic very easygoing. And then I'll conclude with some previous year questions that have been asked in UGC examination as well as the NEET examinations. Okay, so I am just giving you a gist of what all I have covered in the another video on models of disease causation. So basically, I have included all the eight important models of disease causation, like miasma theory, germ theory of disease, epidemiological triad, epidemiological tetrad, Being's model, web of causation theory, field theory, and multifactorial causation. Why is it important to study models of disease causation? It is not because it is just asked in the examination, but also whenever you are studying any topic, whenever you are going to start any topic, or whenever you are, uh, you know, planning to study the topic all in all, then it's very important for you to understand what is its history, what did people think about it in the first place, and how that evolution has been made, how things were very simple initially, and how the understanding of the topic became more complicated and more precise. So it's very important for you to understand the models of disease causation as well, because that is going to help you write in the examination. And also, there are questions that are asked in the examinations from the models as well. So please watch both the videos. Talking about the definition of natural history of disease, so it refers to the course of a disease in an individual from the very first interaction of risk factors to its final outcome. If no treatment or prevention is applied, that means in the absence of treatment, what is the story of the disease? Okay, so simple words you can also relate that it is the story of how a disease begins, how it develops, and how it shows symptoms and eventually results into either death or disability or recovery. So this concept is important because it allows public health professionals and the doctors to decide where and when we need to intervene, like should we prevent the risk factors all in or should we screen, or should we start the treatment. So it forms the backbone of epidemiology as well as clinical medicine and public health policy. So just look at this diagram. What is it trying to tell? So first of all, you see in the yellow box we can see exposure. So what is exposure? Exposure is basically the interaction or the presence of the risk factors in case it is a non-communicable disease, and in case of communicable disease, the presence of disease agent. This disease agent or risk factor uh, comes with the host, that is the individual, be it any human being or any living being, then suitable environment, and this environment gives rise to diseases. Now, these diseases have some specific signs and symptoms, and case the immune system is of fighting back, the person goes into the recovery phase, and then the disease symptoms and signs gradually reduce. But some cases, when the immune system is not able to fight back, the outcome might be death or disability. Why it's important to study the natural history of a disease? What is the relevance of studying natural history of disease, especially in public health and community medicine? So first of all, provides the basis for designing interventions. Like I have already discussed, that health professionals decide when and where we need to intervene. Okay, provides the basis for designing interventions, and it's not only about the timing of intervention, but also what kind of intervention you need to apply. Then the second is identify critical points for screening and prevention, how we'll be looking subsequently in the video. Then the third is outcomes at population level. What does this mean? Whenever a disease is present, it's very important to predict what will be its outcome at the population level. For example, of COVID, when COVID started, there were many kinds of assumptions like maybe it's not that virulent. Then it started that no, it's very virulent and it will cause a pandemic all in all. So this natural history of disease helps us understand the story behind the disease, and it also helps in predicting outcomes at the population level. And whenever we are studying public health, that means we need interventions at the population level. We are looking uh, at the health of the population all in all, and not at the individual level. Study a very important part of this topic, phases of natural history of disease. So talking about the phases, we have two phases of this natural history of disease. The first phase is the pre-pathogenic or pre-pathogenesis phase, and the second stage is pathogenic or pathogenesis phase. So the pre word, does it signify? Pre signify before. So whatever before the pathogenesis phase is the pre-pathogenesis phase. So in this phase, the disease has not started, but always remember that the disease has not started yet in this pre-pathogenesis phase, but the interaction between host, agent, and environment is already present. Okay, so what does this mean? This means that the person still feels healthy, but the interaction between host, agent, and environment has occurred. Risk factors and exposures have started accumulating. So, for example, I'll give you an example of malaria. So, in malaria, what is the host? It is basically the human or the living beings. What is the agent? Plasmodium vivax, Plasmodium falciparum, Plasmodium malaria. These are the agents responsible for malaria. What is the environment that is responsible for malaria? So basically stagnant and dirty water, because it provides breeding grounds for mosquitoes, and we know that malaria agent is carried uh, by the help of mosquitoes. Okay, so such cases, you can see that in the slum people, they do not have access to bed nets. So, and also they are exposed to such environment. So these parasites are circulating in the community where they live. So maybe they do not have malaria at this moment, but the interaction between host, agent, and environment has already occurred. Okay, so maybe no one is sick there, but the risk is present. This comes under the pre-pathogenic or pre-pathogenesis phase. Risk factors and exposures accumulate. Disease has not started yet, but there is an interaction between the host agent and the environment. Let's talk about the pathogenesis phase. So, pathogenesis phase is the second phase. This begins once the agent enters the host. So, it has two parts, the subclinical stage and the clinical stage. So, what all comes under the subclinical stage? The subclinical stage is basically the silent changes that happen, but there are no symptoms. At present, no symptoms are present. The slight changes are already present. For example, talking about a disease named tuberculosis. So we know that tuberculosis is caused by Mycobacterium tuberculi, and it has an incubation period of years. So maybe the person has not developed symptoms like coughing or blood vomiting or anything, fever or anything like that. The person has not started with any kind of symptoms, but they already have that agent inside their lungs. So they affect other people, but the changes happening in their body are silent. So you can when you write in your examination that in subclinical stage you can give the example of long incubation period of tuberculosis, and then you can explain it. So there are pathological changes but symptoms are not present. Talk about the clinical stage. So clinical stage, you know, clinical word, what does it signify? Clinical means signs and symptoms. Always remember, clinical stage, signs and symptoms have appeared. For example, talking about the same example, tuberculosis. So, whenever a person is in clinical stage, that means the person is having cough, weight loss, and fever, and also in severe cases, blood vomiting. So, clinical stage is a stage where signs and symptoms have started appearing. Okay, so I think the phases of natural history of disease is clear to you now. Just you just remember the keywords, and then you can write examples, multiple examples, and keywords will flash in your brain whenever you are writing an answer. So it's very important for you to just know the keywords. Apart from that, you can write on your own. So please remember that whatever I have included in the PPT in the slide, then you need to just have that vision, like so that whenever you are writing an exam, keywords appear in front of you. And obviously, the slide is colorful, so I think that is going to help you somehow. So the next topic is stages of natural history of disease. So overall, there are four stages in the natural history of disease. The four boxes that you see here are the four stages. The first box, that is the green box, has stage of susceptibility. Then we have the yellow box that has the stage of subclinical disease. Then we have the orange box that has the stage of clinical disease. And then we have the fourth box, the pink box, that has the stage of recovery, disability, or death. We also refer to the last stage as the stage of outcome. You may find a stage of outcome written somewhere, or you may find the stage of recovery, disability, or death. So both are same. So talking about these stages individually, so talking about the first stage, the stage of susceptibility. So in this stage, the person is at risk but not yet sick. That means the risk factors are already present, but there are no signs and symptoms yet. So the person is not sick. For example, taking example of a smoker and this lung cancer. Smoker, whenever he's smoking, that means he's already exposed to risk factors, that is the smoke particles. But the person might not have lung cancer yet, so the person might not have any kind of symptoms of lung cancer. So this stage of susceptibility where the risk factors are already present, but the disease signs and symptoms are not present, that means the person is not sick yet. Then we come to the second stage, that is the stage of subclinical disease. In this stage, there are pathological changes happening silently, such as, for example, latent TB infection. So, what does it mean? Changes are happening silently. Okay, the signs and symptoms are not present, but the agent is already present inside the individual. So you can relate it with tuberculosis example that I gave previously in the pathogenesis phase. Okay, then talking about the third stage, the stage of clinical disease. Stage disease manifests with signs and symptoms. Signs and symptoms. So at this stage, the disease manifests with signs and symptoms. For example, when we talk about active pulmonary TB, then the person is already having signs and symptoms like fever, coughing, or blood vomiting, or signs like this. So it is a stage of clinical disease. And then we have the fourth stage, that is stage of outcome or the stage of recovery, disability, or death. So final stage, which may be formed when immune system is strong enough to fight back, then the person might go into the stage of recovery if the person's immune system is not that well, or if the person did not take any kind of interventions, then the person might be going into the stage of disability or death. Okay, so you can see that two arrows that the arrow the upper arrow shows the natural history of disease progression. That means that a disease progresses from the stage of susceptibility to the stage of subclinical disease to the stage of clinical disease, and finally to the stage of outcome. Okay, lone arrow, it is basically showing that there is new paradigm, like shift of disease progression to improved health. That means the natural history of disease is from stage of susceptibility to stage of outcome. But whenever a person is, taking proper amount of the medications, or the person got screened at a particular time, so that is going to reduce the disease progression. Okay, so if a person is taking the treatment, the disease progression might shift to left from initially, or ideally, the shift or the natural history of disease progression is from left to right. But in case the person has started his treatment, or he took the diagnosis at the perfect time, then the paradigm will shift from right towards left. Okay, so whenever the paradigm or progression of disease shifts from right towards left, that means there is an improvement in health. Okay, now just see above the stages there are some arrows. So what does these mean? So you can see that there is an arrow of exposure between the stage of susceptibility and stage of subclinical disease. So we know Stage of susceptibility, risk factors are present, but the person is not sick yet. That means that the exposure has already begun. The exposure is already present. Why? Because risk factor is the exposure. Okay. Then talking about the second stage, the stage of subclinical disease. So in stage, the pathological changes that are occurring. These pathological changes are silent yet. That means they have not shown any kind of signs and symptoms. Okay. Arrow of symptoms between stage of subclinical disease and stage of clinical disease. What does this mean? This means progresses from the stage of subclinical disease towards stage of clinical disease. Signs and symptoms start appearing. Okay. Mhm. Uh, uh, okay. When can I visit a doctor? So most common answer would be when I kind of sign or symptom related to it. So in most of the cases, especially in India, the medical intervention is more treatment type. We focus more on prevention in primordial levels. Now, government is doing great stuff for improving the primordial and prevention stages too. But most of the time, at the individual level, we see that whenever we suffer from any kind of signs and symptoms, then we go to the doctor. And that is we find any kind of clinical features, then we go for diagnosis. So in stage of clinical disease, the signs and symptoms are already present, so the person gets diagnosed. Okay. And whenever a person gets diagnosed, then doctor, they prescribe medications or test, so that is required for the treatment. Okay. Person takes treatment or therapy and that therapy or treatment suits him, the person would result in person's health would result into recovery. In case the treatment does not work or the person did not get diagnosed or did not take proper treatment, then the person might go into the stage of disability or death. So I think the stages of natural history of disease might be clear in your mind by now. So let's move forward. Important concept in this topic is the iceberg phenomena or iceberg concept of disease. So what is an iceberg? So iceberg is a mass of ice that has a very small part of it visible above the water level and the maximum part of it is invisible, that is below the water level, the submerged part. So likewise, what happens whenever a ship is sailing, then the captain is able to see only the visible part because it is above the water level. So he is not able to identify what lies below the water level. So that leads to many kinds of accidents, like that in Titanic. Okay, so also we relate to this phenomena. So what happens that the tip of the iceberg above water represents the clinical cases. That means the tip of the iceberg above water represent the people who actually take the treatment. So might be experiencing signs and symptoms. So, whenever they experience signs and symptoms, then they go to the doctor to seek treatment. So these are the cases that are visible. Okay, because why visible? Because they are having signs and symptoms. But there is a much larger hidden mass below the water. That is the subclinical cases, the carriers, the latent infection, and undiagnosed cases. Why this happens? Because we know that whenever we have any kinds of signs and symptoms, then we go to seek treatment. But whenever there is no sign and symptoms, or like in subclinical cases, the signs and symptoms do not appear, only the agent is present. So how am I going to know that any agent is present inside me? That's very tough. So I won't go to the doctor for checkup. So this creates a lot of cases that are invisible, like the subclinical cases or the carriers of any kinds of diseases. Then we have latent infections. For example, in tuberculosis, the person has two phases, basically latent and active phase. So during the latent phase, signs and symptoms have not appeared, but the agent is already present inside the individual. So this latent infection comes under the invisible cases, that is below the water level, or you can say that these are the invisible portions. Then there are many undiagnosed cases that also come under the invisible cases. So you can see that the visible dip are the clinical cases. Clinical cases means those having signs and symptoms. Then the hidden portion, that is below the water, these are the subclinical cases, carriers, latent infections, and undiagnosed cases. What is the significance? Significance of this concept is that explains burden of disease. Okay, and explains the burden disease is far greater than what is visible, because you can relate a small portion of the disease is visible. Why? Because signs and symptoms, so it is visible, but a major portion of the disease is invisible. So the burden of disease is far greater than what is visible in any kinds of diseases. So it is very significant concept in any kind of whenever you are studying any kind of disease. Okay. For example, in case of polio, for every one case of paralysis, about 100 silent infections occur. You can just imagine 100 subclinical cases occur, but among them, only one clinical case occur on an approximate. So, similarly, you can also relate with COVID-19 cases. Most of the cases were asymptomatic and went undetected. Whenever the person experienced any kind of signs and symptoms, then only the person went for any kind of treatment. So these are number of subclinical cases that are invisible for any kinds of disease. Okay. So it shows that the visible burden of disease is only a small fraction of the true burden. That means the true burden is far greater than what is the visible burden of a disease. Now that we understand how disease progresses, so let's talk about prevention. So in the levels of prevention, we have basically four levels. The first level is primordial prevention, second level is primary prevention, third is secondary prevention, and the fourth one or the last one is the tertiary prevention. So in primordial prevention, we are preventing risk factors before they even appear. Okay, so primordial prevention risk factors are not present, and we are reducing the chance of emergence of risk factors. For example, by health promotion and health education, we try to prevent obesity and smoking. So this comes under primordial prevention. And primordial prevention affects population approach, affects population by reducing overall risk. And then we talk about the primary prevention. So pre- basically preventing disease before it occurs. That means during primary prevention, risk factors are already present, but the disease has not yet occurred. For example, vaccination, sanitation, and lifestyle modifications, these actually have risk factors, but then the disease has not yet occurred. So it affects at risk populations or environments by preventing problems. Then we have third level of prevention, that is the secondary prevention. We are detecting disease early and treating promptly. So how does it affect individuals by the conditions or needs? So basically, secondary prevention is an in-based prevention strategy, and it helps in detect conditions or needs and starting the treatment as early as possible for the best diagnosis, for the best progression. Okay. And then we have the fourth type or fourth level of prevention, that is the tertiary prevention. So, this prevention, we are reducing disability and restoring function. For example, physiotherapy after stroke is an example, classical example, or you can say rehabilitation is a classical example of uh, tertiary prevention. So, in tertiary prevention, affected individuals are uh, trained in such a way that the conditions are, lessening the negative impact. That means, for example, in simple words, I say, whenever there is a person who underwent any kind of brain stroke, ischemic or hemorrhagic, any kinds of stroke, person has hemiplegia or quadriparesis like that. So what happens in these conditions that the the muscles become flaccid, they become inactive. Person is dependent on somebody else for their daily living. So in such cases, the physiotherapists work on the muscles. They try to make that muscle as functional as possible so that the person need not be dependent on others for their basic needs. So what is it? It's not like a person underwent any kind of stroke and then they came to a physiotherapist, and then out of a sudden the physiotherapist actually restores their muscle power from 0 to 5. That's not possible. But then we work uh, we work regularly, actually 0% level 3, so that the person has limited disability. So it's very important. Rehabilitation is very important. Restoring the lost function, and it helps in making the person more independent. So tertiary prevention, always remember, the tertiary prevention is related to rehabilitation. Whenever such questions arise, please do correlate that rehabilitation is related to tertiary prevention. Okay. Now we have the flow chart of disease progression. So this is basically that how we can reduce the progression from stage of susceptibility to subclinical stage. So that is through exposure reduction. That is, in case the exposure is present, then we need to remove that exposure so that the disease does not progress from susceptibility stage to subclinical stage. They have the subclinical stage and clinical stage transition. So in this transition, during clinical stages, the symptoms start appearing. But in the subclinical stages, the agent is already present, exposure is already present, but the symptoms are not showing up. They are silent. So in case we need to reduce the progression from subclinical to clinical stage, then reduce the onset of symptoms. Okay. This is talking about the clinical stage and its relation with the outcome stage. So what happens that during the clinical stages, we do diagnosis and treatment. So whenever the diagnosis is as early as possible, and the treatment is also done as early as possible, that will lead to better disease progression. That is, the outcome would be better. That means the recovery chance would be better as compared to the disability and death chances. So we need to remember that in clinical stages, to reduce the outcome, we need to detect the disease as soon as possible and then start the intervention as soon as possible to make the individual recover and not lead him into disability or. So it's practical with tuberculosis. So in the susceptibility stage, poor housing, poverty, malnutrition, and exposure to TB cases increase the risk of tuberculosis. Then, at the subclinical stage, the tuberculosis bacteria, that is Mycobacterium tuberculi, may remain latent in the body. That means no signs and symptoms are showing up, but then these are present inside the body. The it's also detected through positive Montauk's test, and there is no symptoms present. We have clinical stage. At the clinical stage, symptoms like cough, fever, weight loss, they actually show up. So then we do some kinds of test, and then we start the treatment. Okay. Finally, outcome of tuberculosis may be recovery, visual seeked for treatment, and it may also lead to lung damage, leading to disability, like the person may feel shortness of breath or difficulty in breathing, or even tuberculosis may also lead to death. So the outcome may be either recovery with treatment or disability due to lung damage or so you can relate it with tuberculosis, and then you'll be able to remember it very well. And what is Montauk's test? It is the test for tuberculosis. It is the test to show that Mycobacterium tuberculi are present inside the uh, body, especially the lungs. Talking about the pulmonary TB. So in the subclinical stage, the Montauk's test comes positive because in this stage the Mycobacterium tuberculosis agent is all present, but then there are no signs and symptoms yet. Okay, to summarize, the natural history of disease describes the entire journey of disease from susceptibility to outcome. It includes pre-pathogenesis phase and pathogenesis phase. Then there are some models of causation that you can refer to in another video. Then, understanding this concept is crucial for applying different levels of prevention. And remember, the iceberg phenomena reminds us that what we see clinically is just the tip of the problem. The real burden of the disease is far beyond what we see. Now we have some previous year questions that you can just answer, and please try to comment below. And in comment, whichever comment will be having the correct answers, then I'll be pinning that comment. And apart from that, this brings us to the end of today's session on the natural history of disease. I hope this was clear, engaging, and useful for your exam preparation as well as your public health understanding. Found this helpful, and the content was, if you find the content valuable, then please do not forget to like, please share among your college students or your friends, and please subscribe to Public Health Insights. And any feedback that you want to give, you can just comment below, or you can contact me on LinkedIn, but better if you could just comment below. And see you in the next video. Thank you.